Laura Andreychuk has been a nurse since 2003, working in the cardiology program since 2007. As the clinical coordinator of this program, she supports, advocates, and helps women navigate through their symptoms to ensure that they get the most prompt and efficient care. In 2019, Laura won the Prestige Eye Care Employee Award at Sault Area Hospital. Laura, welcome to Elevating Women's Wellness. Thank you for being here.
Thank you so much for having me.
So, tell us about yourself and how you became interested in nursing and particularly in cardiac care.
I've been a nurse since 2003. I've always wanted to be a nurse. I had a lot of strong role models in my life, including my parents and my aunt, who was a nurse at our hospital and a leader for many years. And so I strive to have that for myself as well. So I went to Sioux College, local. I'm a local girl, and once I graduated, or even before graduation, when I was doing my consolidation, I had the opportunity to do my placement in Emerge and in acute medical. So it gave me a very good eye opening of what it was going to be like, and it excited me and encouraged me to kind of go down that path. So when I graduated from nursing, I took a job in critical care and or ICU, and worked there for the first couple of years, but started to branch out a tiny bit in the hospital. And I started doing a few shifts in the cath lab, which is our cardiology program, which really sparked my interest. And so I eventually left a job I loved in ICU, because I absolutely loved my job and it was full time, but I wanted the opportunity to go into the cardiac program. And so I took a part-time, and it was the best thing I ever did. It's led me on the course that I am in now. And I've been able to accomplish a lot over the last, I guess that's over 10 years of doing this. From there, let me just try to think. I went into the cath lab. I worked in many different roles there. I was scrub nurse, circulating, recovery. I did some pre-screening. I covered for our cardiac care coordinator. Then in about 2011 or 12, I went into the pacemaker clinic and took that over. And so from there on, it became a nurse-led clinic. When I first started, I had about 400 or 500 patients that I followed that had cardiac devices or pacemakers that helped for slow heartbeats. But we had a large majority of patients that have other cardiac devices called defibrillators that are there to help shock people if they go into a bad rhythm. And those patients were traveling every 6 months to Toronto for a check. And it was the same thing I was doing locally, but the problem is we didn't have an electrophysiologist specialist. We didn't have somebody that could oversee that. And so I took upon myself to reach out to Toronto General, reach out to their team. I went down there quite a few times, trained with them, watched how they did the clinic, watched how they worked with the patients, and then I've taken all those patients on. So over the last 10 years, I've grown from about 400 patients to about 1,300 patients, which is incredible. Not only does it prevent them from traveling every 6 months, but also when things such as somebody does get shocked from their device because they went into a bad rhythm and it's doing exactly what it's supposed to, they come to Emerge. I'm called in to assess it. Well, before I didn't have that expertise. Now I can, and I can help to keep them local, help to get the care they need closer to home and not have them travel.
To be able to have that level of expertise available locally and that service for our patients is just it's amazing. And some of the stress and challenge and the financial implications of travel can make it difficult for people to get that care, and that it's local.
I'm so fortunate to have the faith and the trust and the partnership with Toronto General and with Dr. Nathan Kumar is the one physician that I work quite a bit with, and he's put a lot of faith in me expanding this program locally without him being here, and I think it's worked very well for us. And I know that a few other smaller centers are trying to take on similar roles or some similar things. It's just for some people it can be daunting not having the physician present, because at the end of the day I am a nurse and I have become a nurse expert in that field, but I don't have the same capabilities the physician may have in terms of writing a prescription or things like that. I can recommend changes or I can recommend things, But, I still, at the end of the day, I'm a nurse. But along that same line, I did work to develop what we call medical directives at our hospital so that I could work independently and I could do some of that stuff that might have been out of my scope as a nurse per se, but with the medical directives, it allows me to order tests such as chest x-rays, ECGs, blood work. I can change meds. I can provide test results to patients, and all of this with the support of our cardiologist. So when I had come up with this directive, I had passed over with my one-ups and the leaders and with the cardiologists and had their full support. So it allows me to do a lot more independently with their support, but not having to have them stand beside me every day in clinic, trying to work, and alongside with me. It's more of a team effort, a collaborative effort, and I love that. So
Yeah, I think, in my practice too, I very much promote having a healthcare team surrounding you, and each healthcare provider has limits on their scope of practice. And then we can interface with other professionals that can really support that ongoing care. But I love the strategic thinking that you brought with the medical directives, because then it can facilitate, like you said, more independent work and to be able to help patients in a timely manner and have that accessibility available. So that's pretty fascinating. I love the work that you're doing. Thank you for sharing with us about that.
yeah, it just makes it a little bit more efficient. And like I said, it's definitely a team effort, but I mean, it's easy to be successful when you have a great team.
Agreed. So, who are the typical patients that you work with that you're treating in your capacity?
So previously, up until probably about a year and a half ago, it was the majority of the cardiac device patients, those 1,300 patients that I was referencing earlier. Generally, they have either a slow or a fast heart rate, and so they have a device put in to help facilitate that. That's kind of the Coles Notes version of it. But about a year and a half ago, we had a full-time interventionalist, Dr. Picard, come into our community. So he puts in stents, which has been a huge thing for our community. Previously, everybody had to go out of town. They had to, if you have to have open heart surgery or any valve surgery, we have not taken that on. But if it's a smaller blockage and they can have a stent, then that is put in. And so up until recently, it was more the cardiac device patients. But when he came to the community, I've now taken on an expanded role in the outpatient cardiology clinic on a whole, as more of a coordinator role as opposed to just pacemaker nurse maybe. And so for that, I see patients through three different sources. One, usually either through Emerge, the family physician, or through the cath lab. And these type of patients might be somebody that have come in through Emerge. They've had some chest pain. Maybe we did some testing, but they're safe enough to go home. There's nothing acute going on, but we do need to do some further investigation. So those those referrals will come to me. If they've gone through the cath lab and they've actually received some type of intervention, like a stent, or had, a pacemaker put in, or a cardioversion, some type of event in the cath lab, then I would see them and follow up. And then the family physician. So somebody that had went to their own family physician or a specialist, they require some more testing. So previously what would happen is these referrals would come in. The doctor would kind of take a peek at them, see who was, more urgent, triage them, and then say, okay, this is, bring them in a month. And then we would bring them in and say a month, and then they would look at it and say, well, I can't help because I need to get an echo first, I need an ECG first, and I need a stress test first. So then they'd come back in another month. So part of my role is when the referral comes in, I triage it. I gather any of the testing that has been done that's pertinent to it. And then I'll order any testing that needs to be done that would speed up the process so that when the patient actually does come to see the cardiologist, he has everything right in front of him. I think the patients like it better too, because in the meantime of waiting maybe to see the physician, I give them my business card. I give them a lot of them have my personal cell phone, and they'll call me and be in touch with me. And that way, if something does come up in the middle or we're waiting for an echo and it's not another month, and they call and say, hey, Laura, I've been having this chest pain though, and it's not going away, then that's something that I can bring to the physician and say, maybe we need to bring in earlier. So historically, I used to always say I'm like the electrician of the heart, and the stenting part is more like the plumbing of the heart. So I'm now, kind of taking on both roles with that. Those are the kind of the typical patients. They're, either ones that are risk for cardiac disease or ones that have active or previous cardiac disease.
Mm-hmm. So I'd like to hear specifically, what are the key indicators of heart problems in women?
So women sometimes don't always have the same typical side effects that you might hear about that men have, or that are communicated as heart attacks on TV. You hear a lot of the crushing chest pain and a lot of that stuff. But sometimes women can have a little bit more subdued symptoms that they can also easily pass off. Example would be shortness of breath, weight gain, sleeplessness, waking up often, swelling at the feet. Sometimes they'll have a little bit of pain. We get a lot of indigestion and nausea. So it's not necessarily the atypical symptoms. Women tend to have disease more in the smaller blood vessels, in the microvascular, whereas men tend to have it in the bigger, larger ones. So when you hear of things such as, the widowmaker, which is a big blockage in the left main, which is a big main artery, that's more often with the men. Women, sometimes it's harder to diagnose because they are in the smaller arteries and in the smaller areas. And so on occasion, we'll do a stress test or an angiogram. And the purpose is to run dye through the heart, take pictures and see if there's blockages there. But if they are in the smaller areas, sometimes it's harder to see it. Sometimes you don't think that it's going to cause as much symptoms. And so we might decide to treat as what we call medically, which is not putting a stent in, it's medication and lifestyle changes. The symptoms can get passed off easily for other things. Like I said, indigestion, or I was sleeping horrible, or my back is sore, but maybe because I was carrying my baby all day yesterday. So it's just being aware of some of those kind of key indicators that, you want to watch for.
True. And would you say it's more like the accumulation of those symptoms, that there's more than one, or could it be a singular symptom that's presenting?
Definitely a singular. A lot of people just have shortness of breath, or I think what a lot of it is sometimes lack of knowledge of the symptoms. And so what happens is they come in complaining of shortness of breath, but then once I start talking to them and asking them, have you noticed, that sometimes you're up at night and you have a cough and, are you difficulty sleeping? And sometimes that can be a sign of congestion and people don't realize it. Or they look at their feet and they say, oh, my feet aren't swollen. I don't have swollen feet. But if you're sitting in a chair all day, then your swelling is at your belly, or sometimes it's not at your feet. So then you're, okay, well, maybe you don't see swelling at your feet, but have you noticed that your belt buckle has had to adjust itself? It's sometimes those symptoms that they don't realize that they're having that are there because they just don't connect it together.
True. And thank you for clarifying that, because I think the self-awareness that could be brought to our audience to really check in with those things and be clear about them and see how those could potentially be connected to a heart issue, that should be something that's ruled out if that's a concern. In the research, is there anything that tells us about why it might be that for women, they have more of the microvasculature, the small blood vessels of the heart that are affected versus the larger ones like you would see in men? Is there any indication in the research of why that might be?
I don't know the whole reasoning behind it all. I just know that it definitely has been something that they have found.
Yeah. Which I think is so important to acknowledge that that's a common finding, and that might be some of the reason too why women have more subdued symptoms if it's not.
Yeah, I mean, now you got piqued my curiosity that I'm gonna be like, okay, what? But no, it's something, like I said, I've been aware of and I've read about, but I'm not sure how it's tied together. That the patients that are constantly coming in and calling and having issues, but we've done every test and every test is clear. It sometimes tends to be the women, and then eventually something shows up and boom, we've caught what was going on. But for example, even with a pacemaker, we tend to put a Holter on somebody, a little monitor that monitors their heart, and they wear it over a couple day period because we want to see if they're having pauses or they're having issues. And sometimes, we don't catch it. We can put it on 3-4 times, and then finally, eventually we do. I do find it seems like, the ones that are a little more frustrated and don't always have an answer initially tend to be the women. And maybe it's too just our personality types sometimes too. I think we're more diggers and more, well, why? Then why am I having these symptoms? Whereas sometimes, I find men, if someone says, you have some blockages or you have this issue, they're just like, okay, well, let's fix it and let's move on.
Yeah.
You just need to stay strong and be active and be your advocate for yourself, be verbal, talk to your doctor and just say, this isn't okay. I still don't feel right. I know the tests aren't coming back of, showing that there's this major disease, but something is off.
Yeah, absolutely. Which leads me to my next question. Why is advocacy important for women?
We live in a very subjective world. And so even though there are data and tests to be able to back that up, at the end of the day, it sometimes is a subjective decision that one of the physicians might have made. And sometimes you just need another insight or another thought process to see that. And you realize, oh, this is what's going on. And sometimes it's not the heart. There's been times too where we've investigated all this stuff and there's something is off. And then we find out that it's, autoimmune or, it's something else that has been masking the cardiac symptoms. But I think advocating for yourself and advocating for not just yourself, but the people you care for.
Yes.
We're talking a lot about yourself and how you feel and advocating for yourself. But I think as mothers and daughters and sisters and everything else, we also tend to be the main caregivers a lot of time for our sick ones, our sick family members. I advocate for my patients to bring in a second set of ears to hear, because if that understanding isn't there, then it's hard for me or the physician to be able to get a true feeling of what they're feeling like. But when they have that family member with them, they can advocate for them. They can say, hey, yeah, a lot of times they'll say, oh, have you been short of breath? No, I haven't. And then the other person says, well, yeah, when you were walking down the road yesterday, remember we had to stop and they're like, oh yeah, okay, yeah, I guess I am short of breath. So I find that I learn a lot when their spouse or their family member is with them, and they are a great advocate and a great help.
So true. And I chuckle because I've often seen that in my practice too. And I think bringing that other perspective to the table can help sort of enlighten the full view of what someone's experience might be if they haven't quite remembered things as accurately. So it does help often.
Yes.
I'm wondering what insights you can share to help women navigate cardiac concerns with more ease, from your clinical experience.
One big example I would like to talk about is I think we sometimes also get scared of the unknown. And so a big part of heart disease has changed in the terms of recovery period. So previously, if you had a heart attack, you might have been admitted, you were in bed for 5 days, you weren't allowed to get out, then you slowly, next week you can walk down the hall, the next week you can do this. It was a very long and strenuous recovery period. As women, we probably seen a lot of our fathers, mothers, family members go through things such as open heart surgery and stents. And it can be a scary thing because it was such a long recovery. Well, now it's different. It's a lot different. And I think sometimes, someone has that gut feeling that something's wrong, but they say, well, I can't leave my kids. I can't leave this to go get it checked out. So they're scared of the unknown. But at the end of the day, you come in for, say, a simple angiogram, run the dye through, they find a blockage, we put the stent in, they stay a couple hours and they're home after. So the recovery period is so much more easier. And so, I talk to so many patients, women, men, that will say, I put this off for so long because I was scared, because I saw my dad go through open heart surgery and it took him 6 months to a year to heal. And I'm walking out the same day feeling 1,000 times better. And it does happen. It happens all the time where that stent goes in and right away. They feel night and day. And the recovery period, they go home. Sometimes they'll stay if there's, other issues, but for the most part, it's an in and out procedure. And so don't wait too long because you're scared of what's happening. It could be something that is such an easy fix that might make you feel so much better right away.
Yes, I think that is such a crucial message for our audience to hear. Don't wait if you suspect something, get assessed so that you can clearly know what is going on. And I think it's important to know too, like what that successful recovery looks like, and that it's not what you might think it's going to be, or the stories you might be creating your mind about it, that there could be such a rapid process and repair that you're good to go. You can walk out the door right after.
Yeah. Yeah. 100%. And
Yeah.
and like I said, and that's definitely, and that's something new in our community, even in the last 2, 3 years. I mean, we weren't doing stenting before. So same thing, people, what they knew of, you had to go to Sudbury or Toronto and you'd be down there a few days and getting it done. And so again, it's that fear of the unknown, but having the insight that it's much different now, I think might make people a little bit more accepting to go and get things checked out.
True. I'm wondering too, again, in your clinical experience, what role does stress seem to play when it comes to heart health concerns in women?
I think stress plays a huge factor. Stress and anxiety both kind of go hand in hand. I mean, stress in general can raise your blood pressure. Having high blood pressure is a major risk factor for heart disease. So, it affects that. I know that the stress can also cause arrhythmias or palpitations, and so it can affect the blood flow, which again, long-term consequences if the blood's not flowing properly, or if you're going into arrhythmias. Not to name names or anything, I'll just tell the story. But a gentleman that had not a lot of classic symptoms at all, was a very stressful individual though, because had a very stressful job, and was young, only early 40s, and ended up dying of a massive heart attack. And when they looked into and did more investigation, they had chalked a lot of it up to stress. It was the working the long hours, the staying up all night, taking on the stress of what they were doing in their job. But everything else was, they were healthy, they were eating right, they were doing what they should, but they weren't doing what they should for self-care and for helping with taking care of themselves in terms of the stress. And I think that just led up to problems over the years. But it was something that had happened early in my career that I always remember, because it was so shocking, because there was no clear cut, oh, well, this happened because he's been smoking and he eats horrible and things like that. So,
Yeah.
yeah.
Those typical risk factors that you might look for and associate with the issue. And it sounds like stress is really prominent in that case, and that it can be the driver potentially of cardiac issues. So thank you for highlighting that. I'm also curious to hear, how might women adapt their self-care practices in times of high stress? Because sometimes life might not be so easy and flowing and straightforward. There might be obstacles in our way. So how might we adapt our self-care practices in a way that protects our heart health?
I think, some of the things that I had talked about, or I was jotting down, um, making sure that you take time for yourself. That's a huge thing. That you're sleeping regularly. Like I said, sleep is such a huge factor, and it plays in so much with stress and anxiety, and how you feel the next day. Learning how to utilize coping mechanisms, take a break. I'm a strong believer in the 24-hour rule, even though I can be quite reactive sometimes. That's something I always try to work on, and I try to take the hockey thing motto, and let's wait 24 hours before I talk to the coach, or whatever it is. But sometimes just having that time to reflect, I think it can help to, you just understand things a little bit better
Yeah.
than you first do. Taking a break from the news. I find right now the news is really, and a lot of times I don't know what's going on. my husband will say, "Oh, did you see this or did you see that?" And I'm like, "No," because a lot of times I check out from it, because it
Yes.
can add a lot of stress to understand, to see all the different things that are going on in the world that
Mhm.
are out of our control.
Yeah.
And so sometimes just taking a break from that, talk to somebody about your concerns. That definitely helps a lot. Sometimes when you talk, I know when I chat with somebody that, and now if I'm really upset, then they can help to bring me down, because, you just start to self-reflect and you realize maybe it's not as bad. Socializing is a big one, right? Especially right now in the pandemic, it's easy. And I think a lot of people have gotten to a way of life where we're isolating. And so I think we need to be sure that we're doing that. Yeah, I mean, lean on each other, go for a walk, take care of your body. I mean, that taking care of your body definitely is a key one, because that all plays hand in hand with what lifestyle modifications, and making sure you're eating healthy and you're going for walks and you're doing the things that you should be to try to stay healthy.
So true. I love that. I think that's a great list of self-care items that women can lean in on. And I have a final question for you, Laura. Resilience is a topic that's so important for women's wellness, and it's also a topic that's near and dear to my heart. What would you say becoming more resilient means to you, and how does it apply to the women that you treat?
Well, so resilience. So this was the one that I was thinking a lot about. And what it means to me. I think when I think of resilience, I think of strength. I think that we're a lot stronger than what we sometimes believe we are. Having the ability to cope with stress can be hard. And so learning how to have those, um, thinking about some of those self-care things that we just talked about. Some things are just out of your control, and so learning to be able to control what you can, or let it slide off your back if you can't. Ensuring that you're advocating. And other things, like, again, it goes on the same lines, but I had made a little list that I had thought of what are some of the things that we want to build our resilience and create healthy coping skills. And a big thing is embrace change, accept things you can't control, nurture yourself and your body, lean on others, work on your problem solving skills, create short and long term goals, and take steps, even if they're small, to work towards those problems.
Yeah, that's amazing. I love the way that you look at resilience, and I think those are really great steps that anyone can take towards building more resilience into their lives. Thank you so much, Laura, for sharing your insights, your wisdom today. I know that our audience is going to benefit tremendously from what you shared here.
No problem. And I'm happy to anybody that wants to reach out to me or has any questions. I'm always available for anything. I'm very passionate about what I do. I love my job. I love what I do, and I'm always happy to help anybody. So thank you for this opportunity. I think it's great, and I look forward to seeing the other women that you have on here as well.
Amazing. Thank you so much.
Okay, thank you.